Hi, my name is Hailee Jo Lewis, and this is my pathology presentation for RDR 2233 over pericardial effusion. What is pericardial effusion? It is the buildup of excess fluid within the pericardium. The pericardium is a double-layered and sac-like structure around the heart. Usually there's already a small amount of fluid, which is normal, but a large amount is very, very serious, and when there is too much fluid, it can cause pressure on the heart. So what can cause it? Inflammation of the pericardium following an injury or illness, cancer that has metastasized, such as lung cancer, breast cancer, or Hodgkin's lymphomas, chest trauma, autoimmune disorders such as rheumatoid arthritis and lupus, and underactive thyroid, and use of certain drugs. Pericardial effusion puts extreme pressure on the heart and can lead to heart failure and sometimes even death. The role of imaging in relation to this pathology can help to diagnose, help determine the severity of this pathology, and help decipher the best treatment plan. So my primary modality was computed tomography, which is also known as CT. CT scans are one of the first of the imaging modalities used in order to detect pericardial effusion. However, it is not generally used to look for the condition. Sometimes it happens on an accidental find, but it is still very, very helpful. CT is able to provide several different planes of view, such as coronal, sagittal, and axial. This is the CT image that I was able to obtain from Hospitality in Tyler during my summer rotation, and it demonstrates the pericardial effusion very well. I'm circling it now. Not the best, but I'm circling it. But all of this white right here, that is what demonstrates the buildup of the fluid. This patient presented with severe chest pain, and he just had a lot of pressure on his chest, which, he had all that fluid, which, like I stated previously, was not normal if there was a tons of fluid built up on the heart. My secondary modality was ultrasound. Non-ionizing radiation was used, which makes it way better for the patient, since sound waves were used instead of radiation. And it was a quick and accurate way to diagnose this pathology. This is the ultrasound image that I was able to obtain from Hospitality as well. As you can see, the heart is labeled and the pericardial effusion is labeled, which is that black filled sac where I just did the red, but it's not very good because I can't draw. But as you can see, there is quite a bit of buildup around the heart, and like I said, a little bit is normal. That is not a little bit. So when this patient presented with the pain and the pressure in his chest, you can see why on the ultrasound image. We were actually able to use x-ray as well, so x-ray can help identify signs. The cardiac silhouette will appear enlarged, and unfortunately a radiograph alone is unreliable in diagnosing this pathology unless it is accompanied by other modalities like the CT and ultrasound that I provided before this. So I actually took this x-ray. We did the x-ray image first, followed by the CT and the ultrasound. As stated before, x-ray will show an enlarged cardiac silhouette, which I am circling right now. And on a normal chest x-ray, the heart would not be this large. I mean, this one is almost touching the wall of the rib cage. which in itself is not normal. So treatment for pericardial effusion depends on the amount of fluid that is built up, the cause, and the presence or risk of cardiac tamponade. If you don't have it or there is no immediate threat, your healthcare provider might prescribe one of the following medications to treat the inflammation: aspirin, NSAIDs such as ibuprofen and Advil, or a corticosteroid. If medication doesn't help, surgery or other procedures may be used. A pericardiocentesis, which is the draining of the fluid, may be done to help see if that will relieve some of the pressure and help the pain. If there is bleeding into the pericardium, especially due to like a recent heart surgery or other complicating factors, an open heart surgery may be performed to drain the pericardium and repair any other damage. Sometimes a surgeon may create a passageway that allows the fluid to drain as needed into the abdominal cavity where it can be absorbed. And in some cases, a pericardiectomy is performed. If the pericardial effusions continue to occur despite drainages, a surgeon may recommend removing it altogether to prevent it happening anymore in the future. The prognosis is dependent upon the cause of the disease, which was discussed in previous slides. Patients with malignant pericardial effusions have a poor prognosis in comparison to those who do not have pericardial effusions as often. You should watch for any symptoms or changes in your overall health when it comes to pericardial effusion. And you should also follow up with your healthcare provider when it comes to taking medication and managing your recovery. Okay guys, that is all I have to say. Thank you so much for listening, and here are my references.